you guys doing today? Doing very well. Okay. Today we're going to be talking about risky sexual behaviors and things that can cause sexually transmitted diseases and early pregnancy in teens and young adults. How many of you are between the ages of 15 and 24? Pretty much everybody. We're close to 15. Okay. All right. So we'll get back to that age group in a little bit. A little bit about myself. Like you guys all know that I was in the military. I did medicine stuff for 20 years. Part of that, I ran a men's health clinic. Okay, so I saw a lot of STDs, treated a lot of STDs. It was pretty gross, but it was something that I had to do. So let's get started. So what is risky sexual behavior? Unprotected intercourse. Okay, having sex with somebody that has multiple sexual partners. Sex with partners who inject drugs or have injected drugs at any time, even once. It's considered risky sexual behavior. Okay, and then having sex with somebody that exchanges sex for money or drugs. All right, now we covered that and those risk factors. Get into a little bit about a few of the diseases. There's a whole gamut of sexually transmitted diseases. I'm just going to talk a little bit about a few of them. So. Chlamydia, it's treatable. It's got an incubation period of 7 to 21 days. Okay, so if you have sex with somebody, you can essentially not know that you have it until 21 days later. In men, you get a discharge from your penis. In women, you may get a discharge from your vagina. Sometimes you don't have any symptoms. Okay, and 2/3 of all women and a half of all men don't have symptoms. So it's very serious. And then if it doesn't get treated, later on down the road you can have problems where you can't have kids. So in women it can cause pelvic inflammatory diseases and a lot of other problems. So it's real serious. Gonorrhea, it's got an incubation period of 1 to 21 days. So the day after you have sex with somebody that's infected with gonorrhea, you could essentially have gonorrhea up to 21 days later. Gonorrhea is treatable. Okay. Half of all women don't have any symptoms, and then 1/10 in men. Herpes. Okay, so for herpes, 5 to 21 days after sex with an infected partner, you can get a blister. Not just one, you can get them all over the place. Okay, they're sore, they're painful. There is no treatment for it. You have it for the rest of your life, and you can pass it on to any partner that you have. The medication that's out there is for treating the symptoms, but that doesn't treat the disease. Okay. Syphilis, 1 week to 3 months. So 3 months after you have sex with somebody, you can get syphilis. Okay. Syphilis is treatable. If you don't treat it, there's a few different stages. You can end up going crazy. Al Capone had syphilis, and that's how he ended up dying in prison. Pretty sad. That right there, that's herpes. That's herpes simplex virus, the one that's on the mouth, but herpes simplex virus 2 is on the genitals. But once it goes to the mouth, it's pretty much the same virus. And here we go. We got another slide here. Some of these statistics are pretty alarming, to say the least. And then some other things that go along with risky sexual behavior and having sex when you're young and maybe not using condoms is pregnancy. Early pregnancy in teens is a big thing, nationally and here in Florida. Okay? The cost of pregnancy is about $9,000 for a vaginal birth without any complications. About $25,000 for a C-section. Okay? You can't do the things that you want to do. You guys are all young. Maybe you can't go to college. You have to go work. You have a kid to raise. Okay, so you're not necessarily doing what you want to do, but doing what you have to do. So how can you prevent this from happening? Condoms, abstinence, birth control. For a box of condoms, a box of 40, it's $18. Abstinence is free, and birth control is about $10 to $15 a month for the pill. And there's other methods. There's shots and stuff that you can get implanted in your arm. to prevent you from having a child. So, what are you going to do? Are you willing to spend that less than $1 to protect yourself, even if you're a woman?